All right, hi everyone. Thanks for joining us again this evening. We're going to switch things up a little bit tonight. Instead of a pain topic, we thought we'd talk about another service we offer here at Michigan Center of Regenerative Medicine, which is our hair restoration service. So no better time for me to get the worst haircut I've gotten of the year than right before we present on our hair restoration. Basically, myself and my partner, Dr. Santana, we're both regenerative orthopedic specialists, physical medicine and rehab physicians by training, and in doing the regenerative procedures such as PRP for people's knee pains, hip pains, spine pains. We've had people inquire about PRP for hair, and is it something we can do? And doing the little bit of research that we've done into it, the science definitely supports that it's a reasonable thing to try. And in the course of treating someone's knee pain, their shoulder pain, we'll inject some of their leftover PRP in their hair. And we were pleasantly surprised by the results we were seeing. So really this journey for me began with a family member, my brother-in-law, and he was visiting over Easter, and we did some PRP for his hair, and he saw profound results. And it's something that we just decided would be a good thing to add to our service line. So sitting with me tonight is Tina Pawlich. She is our jack of many trades here at the office, not to mention our RN, our nurse manager, our office manager, and our PRP hair specialist. So she's taken this on for patients who want it as a standalone therapy. You might not have knee pain or shoulder pain or back pain, but if you have thinning hair, and you are interested in doing a PRP procedure to see if that's something that can be helpful. If you're seen in our office, the first person that you'll meet is Miss Tina Pawlich here, and then she'll go over the process, which we'll get into tonight. And you'll get to meet either myself or my partner, Dr. Santana. We like to come in just to validate and verify that we think this is a reasonable thing to try. Again, one of the things we pride ourselves here is we don't offer regenerative medicine for everybody. If we don't think it's something that's going to be helpful for you, we'll be truthful, and that includes hair restoration. So just a little background on hair loss. Again, I don't pretend to be a hair loss specialist. I'm not a dermatologist. If you're having hair loss problems, I certainly encourage you to first start with your primary care physician, and then if necessary, a dermatologist. There are medical reasons why people lose their hair. Most commonly, it's a hereditary thing. It is idiopathic, meaning we don't know why. But there are hormonal causes. There are autoimmune disease causes. There are toxin or exposure to environmental issue causes. There are mechanical things like tying your hair back, wearing a hat too often, those sorts of things. And it would be important to see a true hair specialist to see if you have one of those reversible causes, because those things can have separate treatments like drugs. And minoxidil is a very common one that's prescribed for hormonal. There's oral medications as well. We don't manage those things here, and we don't want to pretend that we do. But all of those treatments can be augmented by PRP. When you have thinning hair, regardless of the cause, PRP can augment, because how PRP works is by stimulating the hair follicle to grow. So if you have remaining hair follicles, if you have thinning hair, by taking your own blood out, concentrating those growth factors that tell our body to produce and regenerate things like collagen in the tendons and ligaments, it also stimulates and tells the hair follicle to grow and make more hair. So I think at this point, I'd like to introduce and bring Tina into the conversation a little bit. And we're also going to do a couple vignettes where we'll show you some pictures of before and afters, tell you a little bit of backstory about that patient. But Tina, if you could just comment a little bit about what it's like with when patients come in for hair consults, how that looks in our office, what that consists of.
Absolutely. So good evening. So the process will start with booking the consultation. I'll be the first one to bring you back and take you to my room. And we'll go over some of the things that you might have. Well, first of all, are you a candidate, right? So have you been worked up before? Do you have any underlying pre-existing medical conditions that exclude you from being a candidate for PRP hair? If you have any type of active infections, active cancers, those kind of things, any bleeding disorders, then you are not a candidate for hair PRP. So once we get through that, we'll go over a thorough medical history. I'll review any medications that you're currently on, and then get to the point where we talk about what are your goals for hair restoration. So what would you like to see? Would you just have some thinning in the back or thinning in the front? Overall, would you like some patients come and they're having thinning throughout the entire hair, the entire head, and they would like that the whole head injected. So we'll go over that, go over your goals. Then I will have I'll step out, I'll have the physician come in and review that chart with you, go over, like I said, your medical history, any questions that you might have. And I go through the procedure with you, which is a relatively easy procedure. We're going to go ahead and draw your blood, and I'll be the one to do that. Once I draw your blood, I'll go ahead and start processing that. I come back in, we'll take some before and afters. Those are very important. We'll start taking some pictures of the area that we are injecting. And then once the sample is processed, I'll bring it back into the room. We'll clean the area that we're injecting off, making sure it's clean, and then we'll go ahead and inject. Now, to inject the PRP, it only takes me probably about 10 minutes, but I would plan on being here for about 45 minutes to an hour, depending on how many questions we have, and I can be pretty thorough in seeing if you, I'd love to talk. So so we'll make sure that you are well aware of post-care instructions and anything that you might have concerns about. One of the big questions that I get is how many treatments will I need? Well, that'll be dependent on what your goals are. For some people, it's typically a minimum of 2 to 3 treatments, though. That is to just get some results. Usually we see results by about treatment number 3, between 3 and 4 sometimes for some people. And that's dependent on the area, how large of an area that we are injecting, and your overall health, right? We know that PRP, the healthier you are, the better you respond to PRP.
And that's across the board, whether it's hair, whether it's ligaments and tendons, the concepts remain the same between orthopedics and hair.
Mm-hmm. So we'll go ahead and go over all that. And then we like to see you, or I like to see you back about every 4 to 6 weeks. So we'll go ahead and schedule that before you leave. Now, a lot of the other questions that I have are how many treatments, when will I see growth? And then the big one is, what does the procedure feel like? It is uncomfortable. It is not without some discomfort. The discomfort, though, I will tell you this, as once I'm done injecting the PRP, the discomfort's gone. You won't leave here uncomfortable and a lot of pain or any of that type of pain or anything like that. The downtime is very minimal. So the day that you leave here, you can return to work. If you're working from home, that's great. If you've got some errands to do, those kind of things, no one's going to be able to tell that you've had a procedure done. I ask that you stay away from, and this is what we do with PRP in general anyways, anti-inflammatories post-procedure, a minimum of 3 days. If you can do it for at least 7 days post-procedure. And again, I will review all your post-care instructions with you. But you'll leave the office looking as though you did when you walked in. So I think that's just about the extent of it.
Yeah, our journey has been really hand in glove with orthopedics. I mean, the concept of how it works and why it works is very, very much the same as why and how it works for orthopedics. So our pre-care and our post-care instructions are very much the same. There are lots that we've learned, in particular in the pain process of how to minimize that pain. The topical anesthetic we use, the type of needle we inject with. We've learned that there are subtle differences when you're injecting hair versus when you're injecting orthopedics. So there are a lot of techniques that Tina's learned and implemented along the way that really minimize that pain, which is, I think, a key point to take home tonight, that yes, it does hurt, and regardless of where you go, PRP is going to be uncomfortable. Mm-hmm. I do think we do as good of a job as anybody, if not better than most, in minimizing that discomfort.
Absolutely. So, and then the other thing that I wanted to touch upon is a lot of people will ask, is this a permanent solution to my hair loss or my hair thinning? And so while it's not a permanent solution, it is a lasting treatment. So these treatments so what they've done is go ahead and cause an inflammatory process to wake up those follicles, and those follicles will continue to grow, and it thickens your hair. So typically, though, our patients do come back. It is something that you need to commit to, maybe yearly. Again, depending on your goals, it may be twice a year. So we certainly don't claim to cure any type of hair loss. What we're trying to do is just stimulate those follicles that have kind of gone dormant, if you will. Which brings me to the other question or concern is if you have an area where there are no follicles, then you are not an ideal candidate. When the hair has completely, the follicle is completely gone, that's not an area that I can help or that we can help here.
What we have seen with those patients is those patients who then get hair transplants and get follicles transplanted from one area of your body to an area that's lost its hair follicles. We can then stimulate those transplanted follicles to improve their hair growth and sprout new hairs.
Yeah, and that's actually what the transplant surgeons are doing now is they're following up with hair PRP, and we have a fair amount of my patients are post-hair transplant, and they follow up with 2 to 3, usually 2 to 3 PRP procedures, and then again, even with a hair transplant, they're still coming back once or twice a year for a booster. Yeah,
we see a lot of people traveling, doing medical, not vacation, but medical tourism for getting hair transplants, going to other countries. So obviously it's not cost effective to go to other countries for their PRP follow-ups post-transplant, and we'll see them here in the office and can certainly take care of those patients as well. I think I kind of hit most of my points as well. We'll get a presentation here going.
Absolutely.
If you have questions, feel free to type them in the chat box. We'd like to get to those before the end of the presentation as well. Now, the idea that this works and that it works very similar to how regenerative orthopedics works really helps us be able to, I think, optimize our patients' outcomes, having the knowledge we have in creating platelet plasma. Platelet plasma, as most of you may know, but as a refresher, comes from your blood. We do a blood draw. Tina does a blood draw. We then process it in a centrifuge, which is a device that spins really fast. Lightweight stuff then goes to the top. Heavier things go to the bottom. What sits in that middle layer is that buffy coat or the platelet-rich plasma. That's what then we isolate, put into our syringe, and then that's what Tina, through her techniques, then injects under your scalp into the area of the hair follicle to stimulate the hair follicle. What's in that buffy coat, that platelet-rich plasma, is all coming from you. And it's the same process that your body uses when it heals a cut. So when you cut yourself or when you damage your skin, your platelets stick together, they release these growth factors that tell your body to grow new skin and connective tissue and heal the cut and heal the wound. And those are the same growth factors that are involved in telling your body to stimulate the hair follicles. So it's all very natural. It's all very much your own body telling itself in a concentrated fashion to stimulate growth right here. And it looks like Dr. Santana has joined us for the presentation of the pictures. We'll be seeing those shortly. And Tina, I think, will give a little clinical vignette, a little background on some of the cases that she's treated when we have hopefully some pictures here to go off of.
Yeah. Can we see any questions? Or?
Yeah.
Hey guys, so I have the pictures here. Can you hear me okay?
We can.
Okay. So Tina, so this is Dr. Santana, by the way. Thanks for joining our webinar. Maybe just walk us through this patient and then how did you go about your evaluation and how did you respond and how many treatments you had to go through?
Okay. So the first patient up is a 52-year-old male who had some experiencing some hair loss with age, just hair thinning, had some male pattern baldness in the back of, you can see at the back of his head there. This picture is the initial one on the left was without any treatment, obviously, and we will take these pictures each visit that you come because it's important to compare, and sometimes you don't see the changes. So I like to pull up our pictures each visit. So the initial picture on the left was without any treatment. The picture on the right was at the end of his third treatment. So he is healthy, no medical history, and he responded very well. Now, did he get a complete full regrowth of hair? No, he didn't. He had a lot of hair thickening and a lot of growth that came in and filled in those areas. And he opted to break at that time, and he was happy with what he had achieved after 3 treatments. And he's going to be back in touch with us. And that's what a lot of our patients do. And I do encourage patients to do that. It's really what your goals are. And I'm happy to do whatever you'd like. The next patient up, actually, Dr. Santana, can we go to the third patient? The third slide in is a 60-year-old female who came to me with very significant hair thinning. And she required 6 treatments to achieve that. And she also chooses to come about every 6 months to have boosters because she worked so hard and endured the 6 treatments. So she was someone that really needed a full 6 treatments. After about 6 treatments, I do tell patients to go ahead and pause and then reevaluate and come back in about 3 to 4 months thereafter. In the interim, I'm seeing you about every 4 to 6 weeks. That was something that's very important I should have mentioned. In between treatments, the treatment time is every 4 to 6 weeks. You do need to commit. I can't have you coming in for 1 treatment at 4 weeks and then go ahead and showing up maybe 8 or 10 weeks later. It's very important for those first couple treatments to be done consistently. The third, the one next to the female is a 30-year-old male who also had some significant hair loss, mostly male pattern in the back. He also did, now that is 6 treatments for him, and he's coming, he doesn't like to go longer than every 3 months for a booster. He's getting married and he really wants to fill in what he's had. So he took 6 treatments for that results. I'm going to skip back to the second slide in. That is a young man who was 25 years old, and he actually responded remarkably after 1 treatment. Now, I will tell you that is not the normal, but that is how he responded. Now, people respond, like I said, these are treatments that have had after 3, after initially just 1, and then the 2 needed a full 6 treatments. The young man all the way at the very end is 23 years old, and he has had 4 treatments in. Those are 4 treatments, and that's the results that he had also. I have treated patients anywhere from 20 and to 70. And I will tell you that I've had some growth. The levels of growth obviously vary depending on the patient's health, and their age does make an important factor. The healthier you are, the better you respond. But everyone, all of my patients have grown hair. And depending on how much you want to grow or how often you want to come and what your goals are will be dependent on your treatment plan. And we'll tailor that to you.
And if I can speak for Tina on her behalf, because I don't know that you'll brag about yourself as much as you should. She is extremely honest and very accurate with her assessments. She has really done enough of these now where she has a really good feel for who she can really help and who's going to see some results, but probably not going to feel comfortable with her goal. So to hear her talk and mention multiple times tonight, it depends on your goals. It depends on your goals. It depends on your goals. She'll be very honest with you on whether those goals are achievable or not. And we're not here to treat you just to have you pay for treatment. We want you to get your goals. Our business and our reputation is built on outcomes, and we want people to get not just great outcomes with their pain disorders and their shoulder pain, hip pain, neck pain, back pain, but also with their cosmetic outcome for their hair restoration. If we're going to do it, we want to do it well, and we want to do it right.
Yeah.
So if you guys want to transition over to questions from the audience. So the first question is from Judy. She wants to know, do you set up an evaluation prior to the treatment?
We do. So I am on the initial consultation. We can do the evaluation there. Some patients request, because of a time constraint, they want to go ahead and have that procedure done that day. That is absolutely, you do not have to have the procedure done that day. A lot of times, the majority of times, actually, we have the consultation and then the patient will go home. I've given them all their information. They've spoken to the physician and myself, and all their questions are answered, and they'll go home and think about that. And then you can come back in for your procedure. But I do have some patients that would like it, and if they're medically cleared, they can have it that day also, the day of the consultation.
Excellent. The other question is from Maria. She's asking if the hair is the same texture, thickness as your existing hair.
So the goal behind PRP is that it does thicken the hair that you currently have. The texture should be, this is also the same, but it does thicken the hair. So, and that's what you saw with that first slide with that first gentleman. It thickened up what he had, and you'll see that in a couple of the patients. It thickens up the existing hair and fills it in, per se.
Yep, and it takes time. When the hair follicle first starts to grow, it is more of a tiny baby follicle.
Correct.
And then after, the normal hair cycle is 4 to 6 weeks. After 4 to 6 weeks is where you see it really full.
Mm-hmm. Any other questions?
So the other question that they had was they're asking about pricing. I can go over this for a second. So when we have patients come in for an evaluation, we actually evaluate our patients individually. We set the price depending on what your needs are. So it's not just as cookie cutter as, you want this, you get this product. So we try and individualize the treatments for our patients, and therefore that dictates the pricing too. But for the most part, we're very much comparable to what the market dictates for this type of procedure, and as shown by our repeat patients as well.
Yeah, and I can only add to that. So sometimes patients come in and they just have a small area. A lot of gentlemen only have the back that's starting to thin, right? That male pattern baldness that's just beginning. Or for some of, like this particular gentleman here, had just that area. He has tremendous amount of thick hair in other spots. So his price is going to be a little bit different than I would do the other previous pictures where I'm injecting the entire head. So that'll be dependent, the size of the area that we're going to be treating.
So that's most of the questions. Now, have you seen patients before that you have found that are not good candidates, and what determined that?
Okay, so we have. I've actually turned. We have unfortunately not been able to help all of our patients that come in for consultations. If you have a large area that has already lost follicles, I can't grow those follicles. I can't regenerate those follicles. Those are transplant, or maybe not even, maybe you're beyond even a transplant if you've lost a substantial amount. That would be determined by the hair surgeon, the transplant surgeon. So we have, or if you have medical issues that are not, they're contraindicated for PRP in general. Those are my two things. So if you have a substantial amount of hair that's gone, that's okay. You've seen some of the patients that we've treated, right? We've treated the entire top of their head. However, if you have no follicles left there, I cannot treat you.
If you're undergoing chemotherapy for cancer, for example, there's a potential risk that if we do a blood draw and we create PRP, that we're taking cancer cells and then injecting those cancer cells back into your head. Not to mention if you're still undergoing chemotherapy and we're trying to regenerate your hair follicle while the chemotherapy is trying to destroy your hair follicle, it just doesn't make sense. In those cases, we won't offer you a PRP. But if it's a situation where we say, hey, I don't think this is going to work, and you don't have any true contraindications, and you say, well, please just try. The good thing about PRP is there's really no risk. Right. So we're honest with you. We'll tell you if we don't think it's going to work, and if you still want us to try it, as long as there aren't any of those contraindications that might hurt you, we'll absolutely try. And miracles, we're surprised sometimes.
Mm-hmm.
That's true. And one more question from the crowd. What is the cost of a consultation?
Currently, the consultations are they're free. The consultations are free.
Yeah, we're not we're not doing any, like I said earlier, Dr. Santa and I are not specialists in hair loss. So we're not going to charge for a consultation when it's not our specialty. This is a free consult. And if we think we can help you, obviously there's a price for the service, but we're not going to charge for the consult.
Mm-hmm.
I think that's all the questions that we have. Do you guys have anything else?
I think we covered it. We kept it pretty close to 20 minutes. We like to keep these as close to 20 minutes as possible. I think we're pushing 25. So hopefully you all found this very helpful. And if so, we'll share the link, and feel free to share it with your friends and family.
And I just to say, thank you. Thanks for watching. And PRP is an excellent treatment for hair loss. So,
sure.
So if anyone is interested in consultation with Tina or Dr. Nabity or myself, please call our office. The number is 248-216-1008. Again, that's 248-216-1008. Through our website, you can contact us through our website as well. It's regenerativemedicinemichigan.com. And your Instagram, Tina?
Oh, it's Regenerative RN.
There you go.
There you go.
All right.
Yep. Thanks very much. You guys have a nice evening.
Good night.
Thanks, everyone.
Good night.